Cold turkey, nicotine patches, chewing gum. Many people are familiar with and have used these types of tactics to quit smoking. But what about Roswell Park partnering with the state of New York to try something new? Texting. This is a free 6-week program of daily texts working toward a weekly goal. Doctors, researchers, and computer programmers have helped to develop this program. It really goes hand in hand with other services from the state like the Smokers Quitline, online coaching, and a free nicotine starter kit. Joining us live right now is Dr. Andrew Hyland, who runs the state's Smokers Quitline. He is chair of the Department of Health Behavior at Roswell Park Comprehensive Cancer Center. It's great to have you on to talk about this. We saw this kind of news break earlier today about this new tool that you have. Can you tell us about the texting program, how it's going to work, and maybe for somebody watching saying, quit smoking by texting? What is this about?
Well, absolutely. The program to get there, if you text quit now to 333-888, and you can initiate the process. It's part of our efforts with the New York State Smokers Quitline. We've run that here at Roswell Park for New York State since 2000. We've helped more than 1 million people with their stop smoking effort through that time, mostly by the telephone. People call us for help. We have coaches that can help smokers work through that process. We have online services, and now we're adding this text messaging program that's built on our core principles that we provide people who call us or come to the web, but it's done in a text messaging format. The data shows that text messaging works. Even just texting alone, obviously, if you have more services, if it's coupled with medication or other face-to-face visits, then you can even get a further boost. But just in isolation, the text messaging program works, can boost your chance of success up to about 50%. And we're excited to roll it out. We offered this up to the Center for Disease Control in a national rollout earlier this year, and now it's being offered to all New York State residents. 333-888, quit now.
Yeah, we're going to share too. I know that there's a website where you can go and learn some more information about how this is going to work and where you can sign up for it. You mentioned this, but as far as what the data tells you about what kind of results people can find on this, so that there have been, I guess, pilot programs or something, so you can actually look and see that this type of program can be successful for people?
Yeah, absolutely. Great question. And quitting smoking is hard. Really hard for a lot of people. The toughest thing that they'll ever do, that they'll tell us in feedback. However, millions of people have been successful, so you can do it, but it starts with making that decision to try to quit. And today, here's a new opportunity. If you don't like talking to people on the phone, the text messaging service can be for you. Again, the data show on average about a 50 to maybe even 70% increase in success. Our own success rates that we see are, in range of that. And you gotta be willing to make that quit attempt. You gotta be willing to make some changes. And you got to be willing to tough it out through those tough parts with the cravings. And that's what our program is designed to provide people with skills, not just information and finger wagging, say, okay, you got to quit. People already know that. It's about skill building and providing people with the armor and the tools to defend themselves when those tough cravings come along.
Yeah, and finally, it's not just texting, right? Do you see most success when you combine this with other parts of the program? I mean, it's really incredible, all the resources that are out there to help people quit smoking.
Yeah, well, cigarette smoking is incredibly harmful. 480,000 Americans each year die from cigarette smoking. I can't understate that, and we see that here, and we work with our patients here at Roswell Park. We see it every day. And when you're going into that effort to decide to try to quit, you need to have a plan. You want to have all the resources that you can so you can try to be successful in that attempt. If it doesn't work out, you've gained experience. And then maybe that next quit attempt will work. But the more tools you can bring, whether it's the Quitline, you could talk to your doctor, you could put it out on Facebook and let people know what you're going through. There's stop smoking medications. Again, the Quitline offers free starter kits to most New Yorkers. And the text messaging program is just another tool in your toolbox. And it should broaden the reach of people again, who might not want to call us on the telephone, but would be willing to interact with us through the text messaging program.
Dr. Andrew Hyland runs the Smokers Quitline for New York State. Thanks so much for joining us. And by the way, we want to show this at the bottom of the screen. If you or someone you know would like information on this or wants to register, the website is nysmokefree.com/text. Dr. Hyland, thank you so much. And thank you everybody for joining us on the town hall.